So yeah, Tammy, you're up next from Respectful Relationships from the Department of Ed in Benalla, and Tammy's going to be talking to us today about respectful relationships. So thank you, Tammy.
Thanks so much. So just letting you know, for those who I haven't met, I'm a social worker by trade, have been for over 25 years, work predominantly in family violence and child protection. Don't hold that against me. And for the last 8 and a bit years, I've been working in the Respect for Relationships initiative with Department of Ed, like I said, based in our Benalla office. And we are a team of two up here in Ovens Murray. Jacqueline Martin is my colleague. She's on leave this week. And myself. So if we can just move to the next slide. Thanks, Carly. I'd like to just acknowledge the traditional custodians of the land and pay my respects to elders past, present and emerging. This is just a brief timeline of what's been happening in the family violence space over the last sort of 11 years. So for those who don't know, the integrated family violence service sector sort of started around 2005, 2006, when the Victorian government said, you're all working in silos. We've got huge gaps in our the way that we're operating. And we need to actually start working together to stop people falling through the gaps and ultimately to stop people from being murdered and seriously harmed in the context of family violence. Fast forward to 2014, we had the murder of Luke Batty by his father down in Gippsland Way, and his mother, Rosie Batty, speaking out and asking for change. We had a Royal Commission into Family Violence in 2015 with the report handed down, 227 recommendations. Recommendation 189 was that every Victorian government school would be signed up to be a respectful relationships school, and that was achieved by the end of January 2021. Yay. We have over 2,000 schools in Victoria involved in the Respect for Relationships initiative, and we have most, if not almost all, of our Catholic and independent schools too, which is absolutely fantastic. Schools began their RR journey in 2017, and since then we've had about 6 rounds of intake. So not everybody came on board straight away. It's been a little bit of a piecemeal approach, which is good because the workforce probably couldn't have coped with that many schools signing up in 1 year. And fast forward to 2024, we had the resources updated and released, and the workforce themselves are just in the process of being trained in those teaching and learning resources. Thanks, Carly. So when we talk about respect for relationships, we don't just mean being kind to one another. It really is about the building and promotion of gender equity in relationships and the challenging of gender stereotypes. This is really critical because we know that the main driver of family violence is gender inequality, and this is both national and international research. So it's really important that we have a whole of school approach. There was a small pilot in 2015 in Victoria of 19 schools, and what they found is that regardless of what you teach in the classroom, if you're not actually role modeling it and making changes to the whole of school approach, involving communities as well and seeing the school staff, is this being their workplace, not just there for students, then respectful relationships and working towards gender equality is actually not going to be successful. Thanks, Carly. So just a few definitions on the screen. Most of you are probably aware of this, but with family violence, behaviour of a person towards a family member, if that person does any of the following there: physical, emotional, psychological, economical or financial, threatening, coercive or any other way controls and dominates and makes that person feel fear. And in 2008 was added behaviour by a person that causes a child to hear or witness or otherwise be exposed to the effects and behaviours referred to in paragraph A. I omitted, I'm very sorry, to let you know that we would be talking about family violence, sexual violence, coercive control and gender-based violence. So if this is something that you might be struggling with at the moment, or if you have any triggers, then please feel free to exit the presentation and come back at about 2:45, 10 to 12 when we'll be finished. So I do apologise, but self-care is really important. Coercive control has just really been understood in the last 5 to 7 years, and is often the biggest indicator of murder in the context of family violence. Often in the murder in the context of family violence, there are instances where there's been no physical assault at all leading up to the murder, and we find that there has been coercive control for some time. So it is a huge risk factor. And gender-based violence, as explained in the Resilience, Rights, Respect for Relationships teaching and learning materials, includes forms of violence that target individuals and groups on the basis of their gender and results in or is likely to result in physical, sexual, or psychological harm or suffering. And we know that a significant proportion of the homicides in Australia are gendered. It's often men, whether or not they're in a relationship with this woman or a complete stranger, men murdering women in the context of gender-based violence as well. Thanks, Carly. Oh, okay. So we're going to bring down the slide so that I can try and see everybody at once. I'm just going to change my view. Beautiful. So what I'm going to get you to do, can everyone access the chat room? Is there anyone that can't access the chat room? No, you're all good. We're going to do a bit of it makes us think. So if we can jump into the chat room, and what we're going to do, I'm going to read out a statement and I want you to write whether it's true or false. Try not to follow everybody else. Just pop in there what you think immediately. Are we ready? Excellent. The first statement is alcohol, drugs use or misuse cause family and gender-based violence. So alcohol and drugs use or misuse cause family and gender-based violence. True or false? No one's going to go first. Oh, well done, Rach. True, false, 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 true, true, false, true. Wow, that's about 50-50. True, false, false, false. Cool. It's actually false. It's not a cause. It's a contributing factor. And there's a big difference between what causes it or drives it and what is a contributing factor. And what's been happening for all of our lives is that we've been led to believe the contributing factors such as alcohol and drug use, mental health conditions, low socioeconomic, awesome, Rach, low socioeconomic, unemployment, all of that, we have been led to believe excuse the behaviour. What this does is actually excuses the perpetrator and removes them from the situation. In order to hold persons who use violence to account, we need to make sure that we really are acknowledging what the drivers are, and then what can exasperate it or contribute to it. Thanks all. So, second one. In 2023-24, rate of family violence incidents compared to Melbourne. True or false?
Tammy, my sound broke up then. You sounded like a robot.
Regional Victoria violence incidents. Oh, I'm so sorry. I wonder what's happening. Can you hear me again now?
Yep.
Okay, thanks, Rach. So 2023-24, regional Victoria experienced a significantly...
It did it again.
Carly, can I get you to read it, please? Have you got it there in the presentation in the notes?
Let me have a look.
So sorry, everyone.
Am I looking at statement 2? Yep. So in 2023 to 2024, regional Victoria experienced a significantly higher rate of family violence incidents, 2,157 per 100,000, compared to Melbourne, 1,172 per 100,000. CSAV. True or false? I
Thanks,
won't
Carly.
participate because I can see the answer. So
Beautiful. You're all correct. No, yes, you are. Sorry, I was looking at the wrong statement. Well done. And hopefully you can hear me again for statement 3. If not, Carly, I'll ask you to read it out, but I'll give it a crack. Well done, everyone. Statement 3. Aboriginal and Torres Strait Islander women are 10% more likely than non-Aboriginal or Torres Strait Islander women to be hospitalised as a result of family violence. So we're saying Aboriginal and Torres Strait Islander women are 10% more likely than non to be hospitalised. Got some trues, a false, some more trues. Okay. Anne-Marie, can I... good question, Rach. Anne-Marie, can I ask you to come off and let us know why you said false?
Actually thought it was higher, in all honesty, than the 10% from memory.
34% more likely. It's huge, absolutely huge. And Aboriginal and Torres Strait Islander women are also more likely to experience violence from multiple people in the family or who are considered family, not just an intimate partner as well. Well done, everyone. If we can get the PowerPoint back up, thank you. So just letting you know that attitudes that excuse or justify violence or shift the responsibility to the victim contribute to a culture that tolerates violence. So what we're doing in schools is really teaching them about what is a driver and what is a contributing factor, how to actually challenge those drivers, and what they can do among the staff, with our community and families, and also with students. Thank you. If we can have the slide back up, that would be fab. Thanks, Carly. Well done, everyone. It's always nerve-wracking participating in a survey where everyone can see your results.
sorry, I'm getting there.
Yeah, that's okay.
Trying to find
That's
my
okay. I'll read out another
share
fact.
screen. There we go.
So the good news is attitudes that are learned can therefore be unlearned. If we want to change attitudes, we need to address the influences of those attitudes. So as I've already said, the umbrella is gender inequality. What sits under that is the condoning of violence against women. Can anyone think of what that might look like? We probably all think, oh my gosh, we don't condone this violence, but can anyone think of an example of what that looks like? Don't be shy.
Calling out like sexist jokes and stuff like that.
Well, perhaps the not calling out of sexist jokes.
Oh, yeah, the opposite. Yeah.
When you condone it, you're not going to do anything about it when you see it. Thanks, Tamika. Beautiful. Men's control of decision-making and limits to women's independence in both public and private life. What's an example of that?
And the man controlling finances.
Absolutely. And not just at the individual level, also at the community level, the society level, the national level. If we think about who makes policy, who makes financial decisions for our country, it's not representative of, not equally representative of women. It's also not equally representative of LGBTIQA plus people, Aboriginal and Torres Strait Islander people, people with disabilities, people from coal backgrounds, etc. So there is definitely a dominance there in that space. It's also really interesting. Some of those stats that we looked at with the true or false questionnaire, even up to and including in the last 3 years, with surveys that are done around Australia, so there's about 24,000 people surveyed for the NCAS data, which is the National Attitudes towards Violence Against Women. There's a lot of young people, particularly, who think that women should have independence and equality in their work life, but not at home, that they still should be doing the domestic chores and the child rearing and things like that. So it's really interesting to look at what the statistics are saying. The third one is rigid gender stereotyping and dominant forms of masculinity. What might that look like in a school? I'm comfortable with silence, people, so I'll just sit here.
I'm not sure. I'm not sure if this is right, but maybe the senior roles are held by males.
In this, as our biggest employer in Victoria, Chris, 74% of teaching staff are women.
Yep.
Yet 74% of leadership in schools is men in Victoria.
Yeah, right. That's interesting.
There you go.
Yep.
Thank you for that example, Chris. And male peer relations and cultures of masculinity that emphasize aggression, dominance, and control. What might be an example of that? The sexist jokes is one of them as well, that Tamika was saying.
So like being tough and not boys don't cry and things like that.
Yep, so that fits with both of them, the rigid gender stereotypes and male peer relations, but also the sexist jokes that you were talking about before. Like in a group, they might be really rude about women and make sexist jokes and stuff like that. The chant that St. Kevin's boys did on the tram back in 2016, where they were being completely degrading in that sort of situation. And if we think about the locker room, you know, the jokes that go on at the locker room or the pub, footy clubs and pubs are the worst. Yep, thanks, Rach. And that's why there's a lot of investment into sports and gender equality. Thanks, everyone. The additional drivers, which we've just got sort of the data around the last few years, is for Aboriginal and Torres Strait Islander women, is the impacts of colonisation on both Aboriginal and non-Aboriginal women, Aboriginal and Torres Strait Islander women. So that's about the additional impacts or those additional intersections or layers of disadvantage and abuse that occurs as a result of being, you know, an Aboriginal and Torres Strait Islander woman. And that can have significant impact, like with the stat that we looked at before. Are there any questions before we go on? I've still got a few bits and pieces, so I'll try not to go for too long. But Carly, is the video next? I'm trying to think what's next in the prezzo. Lovely. We're going to watch a short video about what this looks like in a school environment. It gives a really good overview of what all of those gender drivers look like in a school environment.
I'm hoping
Carly's
this works,
average.
Tammy.
Yep. Thanks.
And the story. All right.
I could hear it faintly, but not see it.
Okay, let me know if you can't hear it.
Okay.
I'll share it now. Everyone can see it?
Yep.
Gender-based violence is a story with
It's really low. I think we need the volume right up.
But what if we could change this story? To do that, we must go back to the beginning and talk about our
Listen
school
closely.
and respectful relationships education. Unfortunately, inequality and disrespect can happen.
I'm turning it up if you can you hear it okay?
It's kind of stopped. I think we can hear it okay, but it's kind of stopped.
In our
It's
school. And when it happens, it impacts not only individual students, but also contributes to a culture in the school community and broader society where people are not seen as equal because of their gender. Schools are where we see gender stereotypes reinforced or challenged. They have significant influence over how students see themselves and their place in the world. When teachers and other students put young people in separate boxes because of assumptions based on their gender, race, or ability, we reinforce stereotypes of what it is to be a boy or girl, man or woman. When disrespectful behaviour is excused or justified, and students
Keep stopping. Sorry, everyone. I don't know why it keeps stopping.
Oh, we might actually move on because it's not very helpful to watch it in bits and pieces.
Bits, pieces. Sorry,
So thanks anyway, Sally.
keep stopping and going back to the start. So
Yeah, no, that's okay. What we'll do is include the link in the minutes and be able to, you'll be able to watch it in your own time. All right, moving on, whole of school approach to respectful relationships. We've got the 6 elements here that fit into the whole of school approach. And you can see if we start in the green section, that's the teaching and learning that Tamika was talking about earlier. The resilience, rights, respectful relationships, teaching and learning materials support Victorian school staff to meet the VCAA, or the Victorian Assessment Curriculum Authority, something like that, helps them meet the requirements around teaching respectful relationships. If schools are not teaching the RRRR, particularly topics 7 and 8, then they aren't actually able to meet those requirements, as there's no other materials that really cover all of that part of the VCAA requirements in the curriculum. Another part which Tamika was talking about at length is the sexual and reproductive health, which is part of the Victorian curriculum. Interestingly, families, and I don't know if you know this, but families can actually pull their children out of sexual and reproductive health classes, but they cannot pull their children out of respectful relationships classes without it being an unexplained absence. So I find that quite fascinating because it's difficult enough to get that work into schools, as Tamika was saying, without making it's mandatory, but it's an opt-out option. So students will learn social and emotional learning around emotional literacy, strengths, problem solving, stress management, help seeking, a bit more around gender stereotypes, and also gender-based violence is what they'll learn. If we go around, community partnerships is about schools building relationships with not just family violence organisations, but also organisations that work in the primary prevention space. So it might be with councils or women's health or other organisations working in this space. Support for staff and students. We recognise that when we are talking with schools about respectful relationships and gender inequality, although it is a purely primary prevention initiative, so we want to stop it before it starts, we cannot have this initiative without having the tertiary response support as well. We have had such an inundation of disclosures of family and gender-based violence since we started, not just from students, but also from school staff in their workplace and families. So we cover all of the spectrum, all of the continuum from primary prevention through to response. And when I say we cover that, we support schools to seek the appropriate response. We don't do the response ourselves. School culture and environment is really critical. If we don't have that, and also school leadership and commitment, we're not going to have respect for relationships being embedded in the school. And you can actually tell when you walk into a school what the school culture is like. What's the culture in the staff room? What's the culture in the classroom, in the yard? What's the culture when they have different events, sports days, plays, things like that? We need to make sure that schools look over their policies and procedures with a gender lens, or as I like to say it, they're gender goggles. You get your gender goggles on and go over everything. We need principals to actually give time to their staff, release time to attend training, to be able to put a scope and sequence together for the curriculum, the education. We need them to give time to a respect for relationships team, which might also be the wellbeing team or something like that, or the school-wide positive behaviours team. And the professional learning, we provide a whole heap of professional learning for free to schools. We often do it just after school hours. It's quite restrictive with time with their EBA. So we have to be quite creative sometimes, but we deliver training on the whole of school approach, the teaching and learning materials, bystander approach, how to identify and respond to family violence for adults and children, more on gender stereotypes. We also look at having student voice forums for them, and how to do baseline assessment and action plan. All right, so you can see it's a whole of school approach. It's not just what's happening in the classroom. If we can have the next slide, please, Carly. Beautiful. Can you please bring down the slide? I've got a couple more things to share before we go to questions. Thanks so much, Carly. That was so helpful. One of the things in the Resilience, Rights, Respect for Relationships updated materials is that we now talk about the term consent from foundation, which has freaked a few staff out, but it's really important. We talk about bodily autonomy, but we now use the terminology of consent. And consent in foundation might look like, can I please borrow your pencil? Thank you. Or would you like to shake my hand? You know, yes, no, whatever that looks like. But it's getting the students used to that terminology around consent. And then by the time they get to sort of 5, 6, they're starting to learn consent around much more intimate and personal situations. We also have a working group around sexual and reproductive health. It's quite a passion of mine, and we have some representatives from schools, a few school principals. We have representation from our school nursing team. Tamika and I have discussed, and Tamika's sort of coming on board with that. Ben Correa was part of it, and then he disappeared and left us. So Tamika's come on board, and there's just a few others that we're bringing on board now. Back in 2020, I surveyed 34 of our schools and found most of them said, yes, we're doing sexual and reproductive health, 1 or 3 sessions in grade 6 at the end of the year. And I was like, well, that's actually not really good enough. Let's see what we can do to support them. COVID happened, so this working group's just got up and running again. We've just conducted another survey, and at the end of the week, I'll be gathering the results to see where we go from here. I think we will be utilising Tamika's document that she shared before to actually support school staff to be able to teach sexual and reproductive health. We, as in the RR workforce, also work with school staff around how to teach consent and things like that. So we've done a few of those sessions as well. But it's nice to have those partnerships and work together with community. Hence, Kat, why I'll be in touch with you in the very near future and others. So schools have to do a baseline assessment, which is basically a gender audit of the school, and then develop an action plan, which is fabulous. And we encourage them to pick 2 actions per year. One of those actions might be, let's review all of our policies and procedures. One action might be, we really need to embed sexual health education into our school because we haven't been doing it very well. It could be anything. And just lastly, to let you know, in our area in Ovens Murray, a few years back, I was contacted by our local CASA, and I was informed by CASA that there'd been a lot of young women, sort of 16, 17, 18-year-old women, seeking support for sexual assault and telling schools that they had been sexually assaulted and there being no response. So what we did in Department of Education, alongside a few of our local services, was develop a training package for schools around how to identify sexual assault and sexual harassment and what to actually do about it. So that's been quite successful, delivering that training, and we're looking at delivering that again. I think that's really important in terms of sexual health education, because if the young people are not understanding what it is, then they may not understand what they're doing is wrong, or the victim survivors may not quite understand what's happening to them is not okay. I think I've rattled on enough. So I'm going to hand back to Kim. Thanks again, Carly, for doing the PowerPoint for me. I really appreciated that. And no stress about the video.
Thank you, Tammy. Wow, such important work you're doing. Still got a ways to go, but it's really, really good to see how much of a difference you guys are already making. Any questions or any comments for Tammy? Please feel free to pop them in the chat, or otherwise just take yourself off mute and jump in. Oh, we've got the link there for the video, so thanks, Carly.
Thank you.
We'll just give everyone a minute in case there was something that somebody wanted to add or ask.
I'm also happy
can I
for
just,
you to share that. Yep.
Oh, can I just say something, Tammy? It's something you told me a long time ago, and I've noticed it ever since. You probably even know what I'm going to say. Tammy told me it's interesting in local papers how often the picture on the back page is of a male playing sport, like a footballer as opposed to a netballer, and the same on the front page. And I've watched that ever since, and it'd be interesting if that's something you're interested in watching, just to take notice of that. And she's right. Yeah, I'd like to think that's changing, and that's been years ago, and I haven't really noticed any changes. So yeah, it's just something you told me, Tammy. I've paid attention, and unfortunately I can't tell you that things have changed in Mansfield. So there you go. Your knowledge is widespread.
Gender inequality is just everywhere, and until we get these on, our little gender goggles, it's hard to see because it's not something we've ever been challenged to look at. I certainly look at the Wangaratta Chronicle every week and just go, ugh.
I also think it's metro papers as well. It's not a rural regional thing.
No. Yeah. Well, 94% of sports coverage on TV is male sport. That's not much female sport coming up, and yet look how many viewers the Matildas have had.
Yeah.
And also, so I was thinking this week with the death cup mushroom case, I was getting so frustrated that they focus so much on it, like, how dare she do that? And I'm thinking, what about all the women that are murdered in the context of family and gender-based violence? They don't get even 1% of the coverage that the death cup mushroom has had. Is that because she's a woman and we don't expect it from her, or we want to actually police, you know, what women are doing and say very clearly this is not acceptable? Yeah, would there have been that much coverage if it was a man cooking with death cup mushrooms?
Yeah, interesting.
Yeah, a really good point. Yeah.
You can't unsee it. Once you see it, you can't unsee it.
Yeah.
Thanks, Kim. Thanks, Chris. That's good to hear.
No, thank you, Tammy. What an interesting session. Thank you.